What if the future of your health wasn't just in human hands, but also in the invisible algorithms of artificial intelligence? Predicting your next illness, maybe before you even feel a symptom. Today, we're diving into a future that, yeah, sounds like science fiction, but it's actually closer than you think. And by the end of this deep dive, you'll have a really cutting-edge understanding of AI's transformative role in healthcare. Insights so profound, you'll really get something that, frankly, 99% of people haven't even begun to grasp yet. Welcome to the deep dive. Our mission today is to unpack some, well, truly groundbreaking sources on the future horizons of AI in healthcare. We're exploring how it's set to redefine pretty much everything, from your personal doctor's visit right up to global public health strategies. Think about your own experiences for a second. Maybe you've had that, frustrating moment waiting weeks, sometimes months for a specialist appointment. It's a pretty common story, isn't it?
Absolutely.
Or maybe you felt just completely overwhelmed trying to make sense of complex medical paperwork, deciphering jargon that feels like a foreign language. And it's even tougher if you live somewhere remote, right? Far from the top-tier medical facilities. It feels like a universal struggle, really, whether you're battling waitlists in a city like, say, Mumbai or LA, or navigating healthcare deserts in rural America.
It really is universal. The challenges of access, efficiency, clarity in healthcare, they can feel frustrating no matter where you are. Like you said, navigating a complex system in a big city or facing the lack of options out in the country, the struggle is real. It often feels like you need a secret decoder ring just to figure out how to get care, let alone understand it all. And what's really fascinating now is how AI isn't just offering like minor tweaks. It's promising to fundamentally tackle many of these very human pain points, streamlining what often feels like this unwieldy bureaucratic beast.
That's a powerful idea, taming that beast, making it seamless. Okay, let's jump straight into the first horizon then. When we talk about a truly intuitive healthcare experience orchestrated by AI, what's the most radical part? How does AI change managing the whole health journey?
Well, I think the biggest shift comes with what are being called autonomous care agents. Now, these are way more than just fancy chatbots or appointment schedulers. Imagine a continuously learning intelligent system. It acts as your sort of personal health orchestrator. From the very first symptom, it manages everything, guiding you through diagnostics, refining treatment paths based on your biology, your history, coordinating follow-ups, even anticipating what you'll need for recovery and long-term health. These agents use adaptive algorithms, neural networks. They're constantly learning from huge data sets of patient interactions and outcomes. That makes the whole system not just efficient, but also incredibly personalized, precise. It's not just about managing tasks. It's about fundamentally changing the patient-provider relationship, offering this hyper-tailored, always-on medical partner, essentially.
A continuously learning health orchestrator.
Right.
Wow. That's a big concept.
Yeah.
Almost like having a personalized, proactive AI doctor on call 24/7, knowing what you need next. Can this learning power scale up, beyond just individual care to maybe anticipating global health challenges?
Oh, absolutely. It scales massively. And that leads us directly to predictive public health. This is where AI's learning capabilities just go exponential. Imagine sophisticated machine learning models finding hidden links across vast, disparate data sets, everything from traditional epidemiology data, real-time disease surveillance, environmental factors, even non-traditional stuff like social media trends, travel patterns, wastewater analysis, you name it.
Wastewater analysis.
Yeah, really. It creates this predictive power far beyond what traditional models can do. AI will be able to forecast disease outbreaks before they become widespread. We're talking about anticipating future pandemics, flu surges, even localized spikes in chronic conditions, and with remarkable accuracy.
Okay, that's a huge shift. Moving from just reacting to actually anticipating.
Yeah.
How does that fundamentally change things for, say, public health officials and for communities?
It's a total game changer. It flips the script from defense to strategic prevention on a massive scale. Instead of just waiting for a crisis to explode, officials can allocate resources exactly where they're needed before things spiral out of control. Think about targeted vaccination campaigns, getting medical supplies distributed preemptively, or rolling out preventative measures early that genuinely save lives and dramatically cut the burden on healthcare systems. It moves healthcare from that reactive fix-it model to a proactive, community-wide health optimization approach. It's less like gazing into a crystal ball and more like having a supercomputer constantly checking the world's health pulse. And it never needs a coffee break.
Right. No coffee breaks needed. The ability to prevent illness on that scale is, well, it's breathtaking. But, okay, prevention is one thing. What about when highly specialized individual treatments are absolutely necessary, like surgery? Can AI really help with those most delicate, hands-on procedures?
Definitely. This is where surgical robotics, powered up by AI, really comes into its own. For so many people, specialized surgery means travel, huge expense, limited access. It's a barrier. But here, we're not just talking about robots handing tools to the surgeon. We're talking about AI enhancing human precision to levels that are, frankly, impossible for a human hand alone.
How so?
Well, AI can filter out those tiny natural hand tremors. It can provide real-time data overlays and guidance right in the surgeon's view. It can integrate live imaging with the patient's data for adaptive planning during the operation. It can even predict potential complications, letting the surgeon adjust course in milliseconds. But the real kicker, the true game changer, is that these sophisticated robotic systems can be guided by an expert surgeon who might be thousands of miles away.
Whoa, okay, so it's not just remote control. It's like extending a surgeon's superpowered skills across continents. I'm imagining someone in a remote village, maybe someone who previously had no hope, finally getting access to a super specialized procedure, like, I don't know, delicate heart surgery, thanks to an AI-guided robot being precisely controlled by an expert in London or New York.
Yeah.
That just obliterates those geographical barriers, doesn't it?
Precisely. It fundamentally democratizes access to specialized procedures, full stop. It means fewer people having to travel vast distances, spend fortunes, or simply go without life-saving care just because of where they happen to live. The expert's hands, augmented by AI, become almost universally available. It essentially makes world-class specialized care a global commodity, not just a localized luxury. This is really about making health equity tangible, powered by technology.
Okay, so we've got AI managing individual journeys, predicting global trends, even assisting in complex surgery. But what about looking at the whole system? Like understanding and optimizing an entire hospital or even a regional health network. Is there a way to model something that complex to make better decisions before they affect real patients?
That really is mind-bending, isn't it? And it brings us to the next big thing: digital twins of healthcare systems. You might have heard about digital twins in manufacturing, maybe? Creating virtual copies of factories or products.
Yeah, I think so.
Well, in healthcare, these are incredibly detailed, continuously updated virtual replicas of entire hospitals, clinics, or even whole populations. These digital twins are constantly fed with real-world data streams, everything from patient flow, resource use, staffing levels, disease rates, intervention outcomes, the works.
So hang on. It's like a what-if machine for public health,
hmm
or maybe like SimCity, but for hospitals, where you can test out changes like adding beds or changing staff schedules without any real-world risk before you actually do it.
That's a great analogy. SimCity for hospitals, yeah.
That's incredible.
Yeah.
No more just hoping for the best or relying only on past data, but what makes it truly revolutionary beyond just being a simulation?
You nailed it with the what if. What makes it revolutionary is its power to model these incredibly complex adaptive systems. You can simulate countless different interventions to optimize policies, resource allocation, workflow before you implement them for real. You can run scenarios to spot bottlenecks or leverage points that, honestly, human intuition might just miss.
Like what kind of scenarios?
Well, what happens if we boost ICU capacity by 10% during flu season? How would a new preventative health policy actually affect disease spread in this specific neighborhood? How does changing nurse shift patterns impact patient wait times and staff burnout? You can model all of that. These digital twins let us foresee the likely consequences of policy changes, resource decisions, operational tweaks, leading to vastly more effective, efficient, and resilient healthcare systems. It's really about building a healthcare system that's constantly learning, adapting, and optimizing itself for the well-being of everyone it serves.
Okay, so when we pull all these threads together, these different future horizons, what's the biggest takeaway? What's the overarching impact for us?
When you synthesize these advances, the autonomous care agents, predictive public health, the surgical robotics, the digital twins, a really powerful picture emerges. It's a future where AI augments pretty much every single decision within healthcare. And this ultimately drives outcomes that are, well, fundamentally more precise, more equitable, and much more scalable.
Precise, equitable, scalable. Can you break those down a bit?
Sure. Precise means healthcare that's incredibly accurate, tailored exactly to your individual needs, making fewer errors, getting things right the first time. Equitable means it's available to everyone, regardless of where they live or their economic status, truly breaking down those barriers we talked about earlier.
Right, like the remote surgery example.
Exactly. And scalable means healthcare capable of efficiently handling huge numbers of people, adapting to the needs of entire populations with agility and ease, not getting overwhelmed. But here's something subtle, maybe like an Easter egg insight that ties it all together. And this is the bit I think 99% of people miss.
Okay, I'm listening.
This isn't just about making the current way we do healthcare better. It's actually about fundamentally shifting the whole paradigm of health itself. AI's constant learning and predictive power across all these systems means healthcare becomes profoundly proactive, not just reactive.
Proactive, not reactive.
Yeah. It moves away from just fixing problems after they happen towards actively maintaining optimal health on a scale we've never seen before, often spotting issues before you even realize anything's wrong. The real hidden insight is that AI-driven health could become so optimized for you personally that it fundamentally redefines what normal health even feels like. Moving from just a baseline of not being sick to maybe a personalized, continuously maintained state of peak performance. That's the quiet revolution here.
Wow. Okay, let's quickly recap what we've unpacked today then. That was a lot. We've explored how AI is building this future with autonomous care agents basically orchestrating your entire health journey. Then there's predictive public health forecasting, global challenges with unprecedented accuracy.
Right.
Surgical robotics democratizing specialized procedures through enhanced precision and that amazing remote access.
Yeah, huge potential there.
And finally, digital twins optimizing entire healthcare systems by letting us simulate interventions before implementation. So you now have a much deeper understanding, I hope, of how AI is driving these outcomes that are more precise, equitable, and scalable. And maybe even how it's set to redefine what being truly healthy actually means.
Which does raise a pretty big question for you to maybe ponder on your own. If AI can actually make healthcare perfectly equitable and accessible and maybe greatly extend healthy human lifespans, what kind of new societal challenges might pop up in a world where physical limits and health disparities are increasingly managed by algorithms? Something to think about.
Definitely something to think about. Okay, we've peered into this incredible AI-powered future of healthcare today. But next time on The Deep Dive, we're taking a completely different turn. We're diving headfirst into the hidden psychology behind why we cannot stop scrolling on our phones and what it's actually doing to our brains. Trust me, you are never going to look at your phone the same way again after this one. You really won't want to miss it. Make sure you subscribe to The Deep Dive wherever you get your podcasts so you're first in line for our next exploration into the surprising and truly fascinating.